So very interesting, the first batch of COVID-19 vaccines arriving in South Africa soon, but how ready are we to distribute those jabs to healthcare workers? To discuss, we're joined by Dr. Aquino Thulare, who focuses on health economics and the National Health Insurance at the Department of Health. Doctor, thank you very much for being with us. So these vaccines arrive from India, but what then are the logistics in place to get them quickly to nurses and doctors?
Thank you very much for the questions. Let me first start by passing my condolences to the Khumalo and Mngoma family on the passing of Sis Sibongile Khumalo.
Yes.
In responding to your question, let me indicate that the department has been involved in preparing for the arrival of the vaccines and also preparing for the full rollout of the vaccination of the category that has been identified. Our phase 1 implementation focuses on healthcare workers, and we have done a lot of work in preparing for those that are going to be vaccinating our healthcare workers, as well as preparing the sites of vaccination that will be taking place in our hospitals and in our clinics, in the public sector, in the private sector, in our pharmacies, in our pharmacies that are going to be contracted to deliver this service, such as our independent community pharmacies, the discounts of this world, the clinics, and all the other groups of pharmacies that have indicated their willingness to participate. And therefore, we have already trained about 3,000 healthcare workers, including nurses and doctors, to prepare themselves for the vaccination. I want to indicate that vaccination is not a new phenomenon. We vaccinate all the time in the health system. We vaccinate children for measles, polio, rubella. We also vaccinate those that are traveling with yellow fever and with other vaccines that are appropriate for the countries that they are visiting. So we believe that our healthcare workers are skilled in providing this vaccination. What is also important,
Doctor, how quickly was my question? So the vaccines arrive in South Africa on Monday. How quickly before, let's say, 1,000 nurses or doctors have been vaccinated? Thank you for saying there will be lots of different outlets, but how fast can we move?
We are not going to start with vaccination immediately on the 1st of February. There are certain processes that have to be followed before you start with the inoculations. We have to go through a process of quality assurance. We check the vaccine through a process that is in place for quality assurance, and this will take around 4 to 5 days. And then thereafter, once we are satisfied about the quality, the vaccine will be dispatched to the various sites that have been identified for vaccination. So we expect that that will happen around middle February, when we will be starting with the actual vaccination if there are no problems with the vaccine that has arrived. And our estimation is that we want to vaccinate the estimated 1.2 million health workers in a phased approach, and we will be doing so with certain numbers that we want to vaccinate per day to ensure that we reach our target by the time the phase 1 finishes. And our phase 1 will also be dependent on the additional vaccines that are going to be arriving, but we expect that we would have finished our phase 1 within 2 to 3 months of initiating the vaccination program.
Okay, so if all goes well, we start mid-Feb and it takes 2 to 3 months. Doctor, earlier we heard, I think it was from a nursing union, that nurses were concerned that they have received no training on how to give this vaccination. But you're saying that 3,000 healthcare workers have been trained up already to vaccinate other healthcare workers. Is that what you're saying?
Yes, we have trained nurses and doctors to vaccinate, but we have also trained the trainers to continue cascading the training. But I want to emphasize that the issue of vaccination is a practice that is commonly done in the health sector. We vaccinate all the time, and therefore it's just to make sure that the healthcare workers are fully trained on understanding what you expect when they vaccinate. But vaccination, it's a normal practice in our health system.
Well, I'm interested that you say this. I got quite a sinking feeling when the president at one stage was saying this is going to be huge, and put it in the context of the rollout of ARVs in South Africa, which we know was massive, the biggest rollout in the world, and that didn't happen overnight. But are you saying that logistically this shouldn't be too difficult for our country, because it'll follow the same lines as other vaccinations that are given periodically? We should do okay.
Yes, I think we should do okay. What is unique about the vaccination for COVID is that, because we are going to be acquiring different types of vaccines, like the first batch that is arriving is from AstraZeneca, and we are considering various other suppliers that will be supplying our stock, and these may require different storage strategies and mechanisms. So we will have to adjust our strategy for distributing in line with the type of vaccine that will be administered. And therefore, it is going to be easy, but we have to follow due process, ensure that cold chain is maintained. If at some stage we use a vaccine that requires very cold temperatures to store, that has to be followed to the T, and that will ensure that we do not allow our vaccines to degrade. So we have to adhere to the required conditions that each of the vaccine types have to be subjected to.
And Doctor, I hope we can chat again. There are so many burning questions about where are those negotiations to get more vaccines, because this is just a drop in the ocean, some would say, given our whole population. Concerns about cost, but one really quick issue. We know Moderna came out and said that its vaccine was okay for our variant of COVID-19. Do we have surety, since we're importing AstraZeneca, that it is actually going to deal with the South African variant, as it's called?
Yes, we are certain that the AstraZeneca will deal with the South African variant, but because we have sent out the serum of people who were previously vaccinated on clinical trials, and they are being put against the variant that was found here in the country. And we believe that this will provide the appropriate immunity. It will generate immunity in our populations. But as you are aware, and this is something that is common in the literature, we are carefully watching the behavior of this virus to see if ever, the vaccine will give you permanent immunity, or it may be immunity that requires a booster either on a yearly basis or 5 years. That is still something that is still a work in progress. The scientists are refining their research, and so you cannot say absolutely certain once you have received your 2 doses, you will never get COVID. And COVID is a novel virus, and it can mutate and come up with other variants. So, but what is most important is that we want to ensure that we reduce the mortality and the morbidity that we have seen, and we think that the vaccination will help us reach that objective of reducing mortality and morbidity.
All right. Unfortunately, we've run out of time, but thank you for chatting to us tonight from the Health Department. That was Dr. Aquino Thulare.